Are you getting up multiple times at night to pee, or you're rushing to the toilet in the daytime? If you're fed up with your life revolving around trips to the toilet, but you're scared to take the next step because you've heard horror stories with regards to traditional ways to treat urinary symptoms related to an enlarged prostate, then this video may be for you. Hi, my name is Dr. Charles Chabert. I'm a urologist and director of the prostate clinic located on the Gold Coast. In the following video, I wanted to highlight for you some of the more minimally invasive treatment options that do exist and are available for men who do have bothersome symptoms that are related to a benign enlarged prostate. But these treatments don't come with the necessary side effects of more traditional treatment choices. For those of you new here, please, if you like the video and get benefit from it, give it a thumbs up, subscribe to the channel, or perhaps share this video with a friend who may also be interested. Okay, if we start with a quick overview of BPH, or benign prostatic hyperplasia, in essence, it is the benign enlargement that accommodates the prostate as we as men progress through life. The prostate traditionally is a small walnut-sized gland that sits underneath the bladder. It's shaped like a donut, and we pee through a hole in the middle. As we get older, the gland increases in size and it gradually blocks off the outlet pipe. It can cause urinary symptoms such as a slow flow, a hesitant stream, taking a longer time to pee, or potentially can result in irritation to your bladder that makes you rush to the toilet, get up at night, or go more frequently. If this sounds like you, don't despair. There are options that range really from lifestyle modification through to definitive treatment. But in today's video, we're going to concentrate on these minimally invasive surgical treatments, which include things like UreLIF, Rezum, and iTind. Now, you may ask, what's the difference between these treatments, and aren't they all the same? Well, the answer to that, put simply, is no. These minimally invasive treatments aim to improve urinary function without the potential side effects of erectile dysfunction, or more commonly, ejaculatory changes. In this video, I'm going to go through these three treatments, highlight and compare and contrast these different treatment modalities, and at the end, give you some examples of who might be appropriate for which treatment. So stick around till the end of the video. Let's start with UreLIF. UreLIF, in essence, is a procedure where we put effectively medical staples into the prostate. In Australia, it's done while men are asleep. In Northern America, I know it can be done as an outpatient procedure in the office. These clips are placed through the urethra. They retract the obstructing tissue inside the prostate and can provide relative immediate relief in terms of obstruction. The procedure is pretty straightforward. It takes 20 to 30 minutes to do. The majority of men do not require a catheter, and as long as they pee satisfactorily after the procedure, can be discharged home. The advantage to UreLIF is a quick and rapid improvement in flow. It can take a few weeks for bladder-related symptoms to settle down. There is no impact on erectile function. There is no ejaculatory dysfunction. One of the challenges with this procedure is that the subset of individuals who have enlarged prostates that are amenable to this treatment is relatively narrow. It's ideal for smaller prostates, bilobar obstruction, i.e. blockage from either side, and an absence of a median lobe. If you'd like to be part of our growing community, please follow the link in the comment section down below and sign up to our free newsletter that comes out on a weekly basis, keeping you up to date with all aspects related to prostate health and various treatments that are available for men. Now back to the video. Treatment number 2 is Rezum, or steam. Again, it's a treatment that's provided through a telescopic camera placed through the urethra. Small injections of steam into the prostate are administered. It does cause some transient swelling in the prostate, and the majority of men require to be catheterized for a few days until that swelling settles down. One of the advantages to Rezum is that it is more user-friendly for a broader range of size and shaped prostates, including those individuals with a troublesome or obstructing median lobe. A downside to Rezum is that it does take several weeks before a man can actually experience any benefit from the treatment. So it's a bit of a slow burner. And I explained to many men that they'll notice no difference for 3 weeks, and gradually from 3 weeks to 3 months, they can expect a gradual steady improvement in the way that they pee. An advantage to Rezum is that median lobes can be treated as opposed to UreLift. Again, there is no risk to erections, but there is, however, around a 5% risk of ejaculatory changes. The final treatment to discuss today is iTind, and iTind is the newest member to this category. iTind really stands for temporary implantable nitinol device. In essence, it's a small basket that is deployed through the urethra into the prostate. It can be done under a local anesthetic, or in Australia, more commonly under a light general anesthetic or some sedation. The basket is left in place, men are discharged home, and we see that gradually the basket increases in size and recreates an open channel inside the prostate. The basket is then removed roughly 5 to 7 days after it's originally inserted. The big advantage here is that no equipment is left in permanently. It reshapes the prostatic urethra, can effectively relieve obstruction, and there is no risk to ejaculation or to erectile function. A limitation is that it is not ideally suited for those men who have a larger, more obstructing median lobe. So how do these treatments stack up? Well, in essence, all three of them are very effective at unobstructing the bladder to a degree that can result in significant improvements in urinary function. One of the ways that we assess the severity of someone's symptoms is with a questionnaire filled out by the patient called an International Prostate Symptom Score. And on average, these various treatments can result in a 50% improvement in these questionnaires. We do see that there is maintained durability in terms of efficacy. However, it's important to know that when we compare these treatments to established definitive modes of therapy, such as a green light, a HOLEP, or a TURP, where we actually remove prostate tissue, they are not as durable, and there is a greater risk that men require retreatment within the first 5 years following initial treatment. And so I often describe to men that when we're choosing BPH treatments, at one end we have these minimally invasive forms, and at the other end are the more invasive forms. As you head up the spectrum, you can expect bigger improvements, more significant improvements in flow, and ideally resolution in bladder symptoms. But the price that you pay really comes down to ejaculatory dysfunction, and if you have a TURP, a greater risk of having erectile dysfunction. So who's suitable for which minimally invasive treatment? Well, certainly in my opinion, Rezum is more applicable to different shapes and size prostates. You can use Rezum in individuals if they do have an obstructing median lobe. If you've got an obstructing median lobe, in my opinion, having UreLift or alternatively iTind is not going to be ideal. UreLift is a great treatment if people have a smaller, less compliant prostate with an open bladder neck, and 4 clips on average can be used to retract the lateral tissue and effect an obstruction. iTind, like I mentioned previously, the newest kid on the block, is also very effective at relieving obstruction in smaller prostates without a median lobe, and for those men who really don't like the concept of having clips left inside. Please, if you have comments or questions, or if you've been through one of these treatments and you're prepared to share your story with others, please leave it in the comments section down below. As always, please give it a thumbs up, subscribe to the channel, and if you'd like to know more about your prostate, please have a look at this video, or alternatively this video here. Until the next time, take care of your prostate.